Can you tell me about yourself?
I have been working as a care assistant for the past 3 years, during which I have gained extensive experience in providing personal care, emotional support, and assistance with daily activities to elderly and disabled individuals. I am passionate about helping others and ensuring they maintain their dignity and independence as much as possible. My compassionate nature, patience, and strong communication skills make me well suited for this role.
Why do you want to work as a care assistant?
I have always been driven by a desire to help others and make a positive impact on their lives. Working as a care assistant allows me to fulfill this passion by providing essential support and companionship to those in need. I find it extremely rewarding to see the difference I can make in someone's quality of life.
What do you think are the most important qualities for a care assistant to have?
I believe that empathy, patience, and strong communication skills are crucial qualities for a care assistant. Empathy allows us to understand and respond to the needs of our clients. Patience is necessary for dealing with challenging situations calmly, and effective communication ensures we can accurately convey information and build strong relationships with clients and their families.
How do you handle stressful situations?
In stressful situations, I remain calm and focused on finding solutions. I prioritize tasks, ensure clear communication, and seek support from colleagues if needed. For example, if a client becomes agitated or uncooperative, I use calming techniques, try to understand the cause of their distress, and address it accordingly while maintaining their dignity and respect.
Describe a time when you had to handle a difficult client. How did you manage the situation?
I once cared for a client with dementia who was often confused and agitated. I learned to recognize the triggers for her distress and used a calm, reassuring approach to help soothe her. I found that engaging her in familiar activities and maintaining a consistent routine helped reduce her anxiety. Patience and empathy were key in managing the situation effectively.
How do you ensure the dignity and privacy of your clients?
I always follow strict protocols to ensure clients' dignity and privacy. This includes knocking before entering their rooms, explaining procedures before performing them, and ensuring they are covered appropriately during personal care. I also listen to their preferences and respect their choices whenever possible.
What would you do if you notice signs of abuse or neglect in a client?
If I noticed any signs of abuse or neglect, I would immediately report my concerns to my supervisor or the relevant authorities, following the organization's safeguarding policies. It's crucial to act quickly and ensure the client's safety and well-being. Documentation of any signs and maintaining confidentiality is also important in these situations.
Can you describe your experience with administering medication?
In my previous role, I was responsible for administering medication to clients under the supervision of a registered nurse. I ensured that I followed the prescribed dosages and schedules, double-checked medications for accuracy, and documented the administration in the client's records. I am also trained in recognizing and responding to adverse reactions.
How do you approach building relationships with clients?
I believe building strong relationships with clients starts with active listening and showing genuine interest in their lives. I take the time to understand their preferences, hobbies, and life stories, which helps build trust and rapport. Consistent and compassionate care, along with maintaining a positive attitude, also contributes to forming strong connections.
How do you manage your time effectively during a busy shift?
I manage my time by prioritizing tasks based on urgency and importance. I use checklists to keep track of my responsibilities and make sure I allocate enough time for each client's needs. Flexibility is also key, as unexpected situations can arise. Effective communication with colleagues ensures that we work as a team to provide the best care possible.
What do you find most rewarding about being a care assistant?
The most rewarding aspect of being a care assistant is seeing the positive impact I have on my clients' lives. Whether it's helping them achieve a small milestone, providing comfort during difficult times, or simply sharing a smile, knowing that I contribute to their well-being and happiness is incredibly fulfilling.
How do you keep up with training and best practices in care?
I stay up to date with training and best practices by attending regular workshops, taking relevant courses, and reading industry publications. I also actively participate in team meetings and training sessions provided by my employer. Continuous learning is essential to provide the best care and to adapt to any new challenges that may arise.